All right, I think we can start now. Okay. My name is Deja Andrews. I am a sophomore here at U of MD, and I am majoring in behavioral and biological science, and I'm minoring in public health. So today we'll be having a peer-to-peer conversation on medical trauma, patient rights, and provider accountability. I'd first like to start out by saying thank you to CAPS for really listening to my story and really giving me a name to what I had experienced. I would like to thank the Center for Social Justice and Inclusion for also listening to my story and helping me put together this event. I would like to thank the student orgs that are backing my talk as well. So Public Health Society, Black Student Union, and Pre-Professional Health Society. Okay. So if any time throughout this presentation or the discussion that you feel uncomfortable, just know that you can always scan the QR code, or you can join this link. So I'll give you a little bit of time to copy down the meeting link, but this is with one of the licensed therapists on campus, Dr. Carmen Bell. So if you feel uncomfortable or you feel overwhelmed, you can always leave and get that. And then also, like, this QR code will be on every slide that the presentation will be held. So I'll give you all a little time to get that. All right. So for most of last year, I spent a long time really looking into really dealing with something that I had not knew the name of. And I really struggled with really grasping what I had experienced. I talked to my family about it. I had talked to my friends about it. And I talked to a lot of people about it, but no one could really relate to my experience when it came to medical trauma. And it wasn't until we went back to school in the fall that I had really understood how much of a hold it had on me. So I'd spent most of last year dealing with something I didn't know the name of, and it had a hold on me so much that I decided to reach out to counseling and psychological services. And it was there that they told me what I had experienced, what it was, and what the name of it was. And it was a medical trauma. So what is it? Medical trauma is a trauma that occurs from direct contact with the medical setting. So it could be at a doctor's office, a dental office, in a hospital, anywhere you can get care, medical trauma can happen. And it develops through a complex interaction with the patient and the medical staff. So that can be a nurse, a CNA, a doctor, physician assistant. Anyone that is providing care can also provide medical trauma. And it can happen in the medical environment. And finally, it can happen because of a diagnosis or a procedure or experiment. So you have to really think about, like, medical trauma as, how does this person react to when they get diagnosed with something? How is this procedure going to impact this patient? And it's a holistic thing, and it's a working definition that came from a book that was on medical trauma and how mental health professionals can really help people that have experienced it. So what does this look like? It looks like the 28% of trans and gender non-conforming people that are not comfortable or delaying care because they don't know how they'll be treated in a medical setting. It looks like people in the ICU, the 20 to 30% of people that get care done in the ICU that have persistent depression symptoms or post-traumatic symptoms from that experience. It looks like the 38% of people that fear dental care in the United States, as well as the 12% of them that have extreme dental anxiety. And it looks like the cosmetic surgery that people get, sometimes they don't know the full extent of the dangers of that cosmetic surgery. And this can be seen in the show My Killer Body that K. Michelle, a singer, put together, where she talks about not just luxuries of the cosmetic surgery, but also the people that need cosmetic surgery done if they've lost a lot of weight, how this really impacts the people that get these cosmetic surgeries. So here's a little insight on that.
The purpose of My Killer Body is to save someone's life. Changing my body almost killed me. Now I have to fight for my life and for others too.
Life-threatening surgeries.
I have arsenic poisoning.
I wake up almost half dead.
Life-changing transformations.
After talking to K. Michelle, I'm very hopeful.
It's gonna be okay. Gonna be okay.
My Killer Body with K. Michelle, a new Lifetime original series. Premieres Thursday, February 3rd. Only on Lifetime.
I think a huge point to also point out with the cosmetic surgeries is a lot of people are getting them nowadays, and they're also causing people to be afraid to continue to get care. So after their surgeries have been messed up, they are afraid to go back to those care providers. Just like all of these other people, if something has impacted them and they feel like their care is secondhand to what they have experienced, they will be afraid to go back to these people that are supposed to be providing care to them.
The purpose of...
So let's get into my experience. Here are the facts. So during my experience, I've never truly understood the procedure that I was going to get. The physician failed to explain to me what that procedure was. So I really felt uncomfortable. For a long time, I felt like I was out of control, and I didn't know truly how to express that. I had experienced pain, and when I had experienced that pain, by making a noise, the provider had told me not to do that. And it felt very invalidating. It made me feel like maybe I shouldn't say anything at all. And then the provider, again, never asked for my complete informed consent. So informed consent is not just you signing off on something, it's also you comprehending what this procedure is going to truly be. And for a long time, it just felt like I didn't know how to deal with that. So after the visit, I avoided the place that it happened. And to a certain extent, I pretended it didn't happen, or at least to the people in my family and the friends that I had talked to about it with, I just, put it in the back seat. This didn't really happen. But in my mind, I had overthought about it on multiple occasions. And for a long time, I had thought about it so much that I just didn't know. I just went silent. And I'm one of the loudest people I know. And when I'm not talking anymore, because I don't know how to even talk about this experience. And then I got upset in a medical setting with a specific gender. So it was the provider's gender that triggered me when I went to go get care again, that I got so upset, it reminded me of the previous experience that I had had. So now that we got a little bit on what medical trauma is and where it can be seen, we can also talk about the history of medical trauma. This is something that is kind of hard to define because medical trauma is not necessarily talked about a lot, but we can really look at different experiences in medical trauma and really look at the history and how that impacts people and their fear of going to the doctor. So now let's look into the father of gynecology and the history behind that.
Dr. Sims conducted much of his research on slaves, like Anarcha, a teenager who was one of many voiceless, faceless black women who suffered through his experiments without anesthesia or informed consent. For 4 years, Sims operated on young slaves repeatedly to find a cure for a condition caused by complicated childbirth that left many women incontinent or unable to control their urination. Anarcha endured 30 practice procedures before Sims finally got it right. According to historian and medical ethicist Harriet Washington, Sims knew the operation was extremely painful, but wrote that using anesthesia was not worth the trouble or risk. In fact, the pain was so excruciating that the woman had to be restrained by 2 male surgeons just to make it through. And that's why many people are now calling for his statues to come down. But Dr. Sims isn't the only physician to use black people as unwitting test subjects. It's only one chapter in a long history of racist medical abuse. In the infamous Tuskegee experiment, federal researchers observed 399 black men with syphilis from 1932 to 1972. A cure was discovered 13 years in, but doctors withheld treatment for decades just so they could continue their work. And that's not even the most egregious example. For decades leading up to the 1970s, white doctors in training performed secret surgical sterilizations, including unnecessary uterus removals on black and Puerto Rican women. In the early 90s, the New York State Psychiatric Institute conducted a study into the genetic roots of violence. The researchers recruited mostly low-income black boys and injected them with a drug known to be poisonous. The boys' mothers were given a whopping $125 for having their sons participate. And to this day, we still don't know the long-term effects this experiment has had on those kids. These stories are horrifying, but racism in the medical field isn't a thing of the past. A 2016 study found that a quarter of medical residents who were surveyed thought black skin is actually thicker than white skin. And many of those same residents also thought black patients felt less pain than their white counterparts and recommended less accurate pain treatment. So it's not surprising that studies have found that black patients tend to trust doctors less. And all of this has real consequences on people's health. In East Harlem, where Dr. Sims' statue stands, 80% of the residents are black or Hispanic, and the average life expectancy here is almost 10 years lower than that of majority white neighborhoods in Manhattan. So maybe it's time we stop celebrating this racist history and start recognizing the centuries of abuse people of color have endured in the name of science.
I think that was just a general insight into some of the medical disparities and subjugation that people have really put on different communities. So now we can really look into a little bit more of the history. And this is back to what the lady in the video had said about the syphilis experiment. But that was just one of the syphilis experiments that happened on the US soil. We should talk about the US going to Guatemala and injecting 5,000 of their residents with syphilis. And really, they did this so that they could see how it impacts people. And even with the Tuskegee experiment, they didn't necessarily inject those people with syphilis, but they did prolong it, and they knew that they had a treatment for it and still withheld that treatment to those people. And it really impacted people because they, even when they were blind, even when they had went and spread it to their families and their children, and even when they passed away, they still were withholding that treatment until someone had put it out there that that was happening. And then this happening in Guatemala by US scientists, putting it into 5,000 of their members, and even till this day, still struggling to get some justice with that. And then we can talk about health disparities again, but we can look in a more general sense with minority communities.
Trying to understand a historical problem without knowing its history is like trying to treat a patient without eliciting a thorough medical history. You're doomed to failure.
That's Harriet Washington, a medical ethicist and author who chronicled the intersection of race and medicine in her book, Medical Apartheid. While many of the stark racial disparities in healthcare can be attributed to environmental and economic factors like access to good healthcare, studies show that minority patients tend to receive a lower quality of care than non-minorities, even when they have the same types of health insurance or the same ability to pay for care.
As African Americans, we've been abused for so long, consistently by the system. Why should we trust it? Why should we go to when ill? And that's iatrophobia. That's a fear of the healer, inculcated by the behavior of those healers, unfortunately.
Again, even if we have, as minorities, even if they have the similar health insurance or similar socioeconomical background, they're more likely to experience medical injustices or disparities, and there's a gap there. So now we can look at how common medical trauma truly is. And, and in children, about 80% of ill or injured children and their family experience some sort of medical stress following a medical trauma. And then about 20 to 30% of the parents and 15 to 25% of the children experience persistent traumatic stress. Within adults, about 1/3 of the traumatically injured patients have experienced PTSD or depression-like symptoms. And then approximately 20 to 30% of ICU patients have experienced some sort of PTSD symptom. So this is just a little insight into medical trauma and how many people have experienced it. And it doesn't necessarily account for the people that don't speak up about it or know what it is. So now we can look a little bit into how to cope, as well as sharing those resources for people that have experienced medical trauma. What to do if you have experienced a doctor visit that was unsatisfying. So you can reach out to our counseling services on campus. Taking time to really take a deep breath. I found like that was the best thing for me, was really being like, this did happen. This was very valid, and really understanding that this is okay, like it's okay to feel this way. Having written all of this information down and really thinking about it, but not overindulging in it. Focusing on your mental health, again, trying not to overindulge in it. I feel like for me, I had spent a long time overindulging in it. And I was like, maybe if I hadn't done this, maybe if I would have said this, but I couldn't go back. And I had to realize that this was something deeper than me. This was something I had to reach out to a licensed professional to get help with. Speaking with your families and your friends, remembering that you don't have to do this alone. There are people there that will listen, and you definitely can talk to them and make sure that they're people that you're comfortable talking with. Going to a different practice. Don't forget that you went to a provider needing care. And if that goes unheard, that can lead to disparities, and that can lead to your detriment in a way, because you need to get care done. And if that care is not provided, then you may be afraid to go back to a provider, and then that can impact your health altogether. You can contact your state survey office. So if you feel like this is something that needs to be taken to the next level, if you feel like this is something that violated your rights or the public health code, you can present your facts, your case, and you can send that to the state survey agency, and they'll be able to really help you take it to the next level and provide that provider accountability that is needed. Again, this is just reiterating, talking to someone that you love, going to those healthcare providers, using different mental health apps. Of course, being mindful that these don't omit necessarily the care that you can get from a provider, and learning that it's okay to just breathe sometimes, and writing down this information can really help you as well. I think everybody's mic is automatically turned off. Yes. All right, now let's get into patient rights. But before we get into that, okay. But before we get into that, let's hold on until we're at the end, and then we can have the discussion. Okay, so here's a few examples of the patient rights. So we're going to look into self-advocating and how that can really save someone's life. So this is a well-known person, Serena Williams.
In a revealing cover story in Vogue magazine, tennis great Serena Williams with baby Alexis Olympia shares her harrowing ordeal.
How you doing, Olympia?
She says holding her baby the first time was an amazing feeling, but the next day, everything went bad. Serena had trouble breathing. She knew it was a sign of blood clots she had suffered before, so she guided her doctors on how to save her life.
Just this idea that somebody like her could experience such a severe complication is, I think, really upsetting to many people and will bring more attention to this issue.
Every year, 50,000 women suffer complications during pregnancy. 700 die. Black women are 3 to 4 times more likely than white women, in part because of higher risk factors, diabetes, obesity, and high blood pressure. Today, Serena posted on Facebook, "I hope my story can inspire a conversation that gets us to close this gap."
I don't understand.
31-year-old Tunisia died giving birth to her second child when her heart stopped after a C-section.
I'm broken inside. I'm broken. Knowing that how much his mom loves him and she's not here.
For me, it's unacceptable.
Doctors say Serena's story is a cautionary tale. So the point being, know your body.
She knew what was wrong. She kept going at it. And I think that's a really important thing, that we all play a role in advocating for ourselves within the healthcare system.
Tonight, Serena Williams, who raised the game for women in tennis, now hopes to raise the standard of care during one of life's best moments. Rahima Ellis, NBC News, New York.
Hey, NBC News fans, thanks for...
Yeah, that was just one of the important factors of really self-advocating. I remember watching and reading a little bit more deeper into her story, and she was saying that when it first had, after her C-section, she said that she had felt as though something was wrong. She couldn't breathe at first, and she told the nurse too that she would need some oxygen, in which the nurse gave it to her. And then after a while, she started feeling a little bit off, and she told them that she felt like something was wrong. They went in and closed her C-section scar again, and they said that there was nothing wrong. But then she said that she's felt this pain before. She knows that there's something wrong. And again, after a series of surgeries, they finally found some blood clots in her leg, and that could have led to her having a stroke, or that could have led to worse. So that is a huge important factor when it comes to really self-advocating for yourself. Because if you don't, then anything can happen. Like something bad could really happen to someone. And she knew her body, she stood her ground. And the sad case is that people don't stand their ground, or they try to and people don't listen, then that leads to a whole another array of things that could possibly happen to that person. So before we get into patient rights, we're going to talk about what you should know before your doctor's visit. You should try to make a list of priorities and concerns. When you're in front of people, sometimes you forget everything that you wanted to talk about. And that's a reality that many of us have. And so just making that list and knowing what you're going to present to this physician or this doctor or whoever you're going to. Knowing your family history. If you have anybody in your immediate family that has any predispositions or anything like that that could potentially impact you, you should know that so that you can be able to present that information to those people that are on your healthcare team. Keeping your doctor up to date. We haven't been to the doctor in a long time if you've been postponing care due to Corona and everything else. So they may not have seen you in a while. They don't know what has happened. So just being like, this may have happened over time. Since the last time I've seen you, this is what has happened. Stating your honest feelings. If something isn't right or you don't know how to say it, just say it. And if you feel like if they're asking you questions that are a little bit more personal, it's not to get to know you or to really judge you in that sense, but like it's more so to really look at you as the holistic person that you are and saying, okay, this is how we can go about treating you. So don't withhold those feelings, that can really lead to a lot of miscommunication. And remember that you're entitled to that inclusivity. You're entitled to that voice. You're a part of your care plan. Your voice matters. Don't withhold it. You won't be doing no harm to anyone else. You're entitled to that fairness. You're entitled to having that voice. You're entitled to getting adequate care regardless of your identity. And you're entitled to justice. Again, if you feel like someone's violated your rights as a patient, you have every right to say, okay, I'm going to take this and I'm going to present it to the healthcare agency or the healthcare licensure and saying that this person violated my rights, because that is a patient responsibility that some people have. Finally, I'll reiterate this again. You're an essential part of your care team. Don't forget to come as you are. You deserve every right to say what you feel. You are a part of your care team, because without you, there would be no reason to have care or to provide care. So don't be afraid to come as you are. No one's there to judge you. Now on to patient rights. So the Public Health Code excerpt of the Act of 368 of 1978 is what people would call the Patient Bill of Rights. This is just some of the rights that I will be presenting to you all. And I think that you can all, these are just some of the rights that I feel like a lot of people need to know about. And this comes down to your identity. They can't deny you appropriate care based on your identity, whether that be your race, your religion, your color, national origin, sex, age, disability, marital status, sexual preference, or source of payment. So regardless of your identity, no one can deny you adequate care. And if they do, then that is a violation of your patient rights. You have the right to your chart for reasonable pricing. So nowadays, there are a lot of people that are really connected when it comes to your chart. So you can have an app on your phone that you can get your chart on within 24 hours. And then you can also get a physical copy of your chart from the healthcare providers after you've gotten your chart done and after your visit. You're entitled to confidential treatment. There are laws that, if broken, can lead to criminal action. And no one can just call up and be like, hey, how's so-and-so? How is their treatment going? No one can call up there and ask that unless you specify that you want that person to know. You're entitled to that privacy to the extent feasible. So wherever you're at, whether it's a doctor office, a dental office, whether it's an emergency room, whether they're using a curtain to shield your privacy or they're using a door, you're entitled to that privacy. You're entitled to exercise your rights as a patient. So if anything's changed in the healthcare facility and that will impact your health, you need to know that. And you also have the right to use your patient rights. So speaking up whenever you feel uncomfortable, letting people know. You're entitled to know who is responsible for and who is providing direct care to you. So if anyone comes in the room, if it's a nurse, a CNA, a doctor, anyone that is coming in that room, you're entitled to know their names. And you're entitled to that information pertaining to continuing your health needs. So if you're on a care plan and the care plan is any kind of, whatever kind of plan it is, you need to know that what is the route that everybody is taking to help you in a way. And then looking at those alternatives. If that care plan isn't the way you want to go, you should know those alternatives as well and being presented those, and then being allowed to be involved in your discharge planning. So if you're being discharged from the hospital, you should know how that's going to work. You're entitled to adequate and appropriate pain and symptom management. Again, they have to assess you on your pain and your symptoms. With me, it was like I was getting a procedure done, and when I expressed pain, the provider had just written it off, and that felt very invalidating. It felt like I couldn't have a voice, and I internalized that in a way. And you're entitled to refuse care. You can say, no, I'm not comfortable with this procedure. I would like to proceed with something else. Or you can even say, no, I'm not comfortable proceeding at all. And then you can look into getting that refusal and signing off on that, or you can even just go sometimes, depending on how far into the treatment you are. And you're entitled to information concerning an experimental procedure proposed as part of his or her care plan. So if you feel like, if someone comes in saying that you need a clinical trial, or if you need anything like that, you're entitled to know what that procedure is about. You're entitled to know, you're entitled to say no to that procedure, as well as that cannot jeopardize the rest of your care. So if you say no to getting a treatment done, you have they can't say that, oh, we're not going to provide care to you anymore. That's not okay. They can't do that. That's a violation of your rights. And then a little bit into what informed consent is.
Raj Alexander.
Informed consent to me as a hospitalist, a practicing physician, is about getting into partnership with the patient so that they agree to the treatment that you're going to give them. They need to know what those effects are, why you're giving them to them, what the alternatives are, what the risks are, and then ideally they would say, yes, I want you to give me the medicine. Otherwise, it's all one-sided. It needs to be a partnership.
It needs to be a partnership. So remembering that it is okay to say no. It is okay to ask those questions, and it is okay to be nervous. We are all human. We all have questions, and sometimes those questions can be hard to ask, but we have to say it. We have to be our patient advocate. And we have to say, and we have to know when to say no. If you feel like this is something that you don't want to proceed with, it won't harm anybody to say no. And it is okay to be nervous. We're all emerging adults. We've had patient advocates being our parents or our guardians for most of our lives. Now that we're present and we have to do our own patient advocating, it can be nerve-wracking sometimes if you've never done this on your own. And that's where it comes to compassionate care providers. This is a term that is heavily used in the geriatric setting or the setting with older adults. But I felt like this could be a term that was used in all settings in a way. So what are some examples of compassionate care? How do people perpetuate this when providing care? And this is when a care provider is not only communicating with other providers, but communicating with people and the patients and their family, communicating to you, communicating to the care providers again, and then also really working together to approach the care plan. How can we help this person make them more comfortable? How can I feel the emotions that this person may be feeling? Because this may be their job, but this is your life. And when it comes to compassion care, they kind of step into your life and see how you are dealing with your pain or whatever you're experiencing. And then really communicating to people is another important part. Communicating to each other, being honest, communicating with you about your procedures, communicating with you about your health, communicating with different providers, keeping everybody on the same board. And then, finally, I think a huge part of being a compassionate care provider is learning when to take time for yourself. And whether that be before you go into work, taking some deep breaths and saying, like, I have to go in here and I have to provide the best care that I can possibly provide. And I have to know when to take time for myself. I've heard people say that on their way home, they blast music loud. Some people don't listen to anything at all on the way home, really trying to debrief themselves after being in this field all day. And I think a huge thing is that knowing that this is a selfless field. And if you go in, you have to remind yourself that sometimes you have to put yourself in the backseat. So you have to be a little bit more compassionate when it comes to yourself as well. So, and then here's a few examples of what compassion care does not look like. It doesn't look like doing unnecessary treatments. A man in Wisconsin was breaking patients' teeth and submitting $4.2 million in bogus insurance claims. He was giving people crowns that were not necessary for insurance claims. Then we have routine preoccupation. Again, you can provide care, and sometimes we get into routines when people are providing care. So when you're preoccupied and you're in that routine, you're more prone to make those mistakes. And this happens recently where a lady was convicted for reckless homicide because not only did she provide care, but she was preoccupied, and she ended up giving one of her patients a paralyzing agent. And that agent at a deadly dose can kill someone. And she ended up giving it at a deadly dose, and that ended up harming a patient. And it wasn't that, of course, you're entitled to make mistakes, but when you're providing medicine, you have to be a lot more conscientious of how you're providing that care. And here are a few claims in Dearborn. There was a dentist that was facing charges after claiming she did procedures that she didn't. And these people may not have been, some people don't do these things in a malicious intent, but sometimes people do things maliciously, and that can impact their patients, and that can lead to that iatrophobia again. If you're not conscious of how you're providing care, you can do more harm than good. And that harm can lead to health disparities among all communities, whether that be a decrease in people's ages because they're afraid to go back to these providers. It can be anything. And that's why it's so important for people to be compassionate care providers. And here are some changes because of compassionate care. Because of previous years, before people started speaking up, people were allowed to give pelvic exams on unconscious women just because of the medical benefit, not because of the benefit of the patient, but because of the benefit of the medical professional. So some people in medical schools were giving pelvic exams to women that were unconscious for a surgery on a whole nother area of their bodies. And this led to a huge change when a woman had experienced a pelvic exam and woke up, and after the exam, and one of the medical students came in and told her that she was on her period. And she was like, "How do you know that? That's not what I came in here for." He was like, "Well, it was because I did the exam on you." And then that led to a huge change where not just the patients were speaking up, but medical students and medical providers were saying, "This is not okay. We shouldn't be doing this." And it led to an authorization in multiple states now. And it's still a work in progress, seeing that a lot of these states don't have these laws for people that are unconscious. But really protecting yourself is a huge thing. And when it comes to compassionate care, people that are your advocate and not just doing their job, but advocating for you as well is a huge part of compassionate care. Now, here is the contact information on the Public Health Society, the Black Student Union, and the Pre-Professional Health Society. And here's some more information with CAPS and the Social Justice Inclusion Center. And I'll give you a few seconds to get that down. And then here are the references. And then here is the discussion. So why is it important to know the history of medical trauma? So we don't repeat history. Yes, that's a great take, definitely. I think that it's important that we know the history is to really just look into how we can do better as people, and understanding that sometimes people have preconceived notions that aren't necessarily the best idea of their patients. So really understanding that, like, there's history when it comes to this. And if we know this history, we can help reverse some of it as well. It helps us realize why certain populations are more hesitant to the medical field and how we can best address those populations. I 100% agree. Okay. And then why is it important to know your rights? Again, I think this was a huge thing with Serena Williams, where she knew that something was wrong and she kept saying something. And that was like a huge thing, because if she hadn't, who knows where she would be now? Does anybody have any other take on why it is important to know your rights? Okay, and then, okay. So we can make sure that we are advocating for our rights and speak up if we have been treated wrong in the medical field. That's such a great thing. Like, that was really great how you worded that. I think that that is so important, because I feel like when I was experiencing medical trauma, I felt like I didn't know my rights, and I felt like I knew some of them, and I knew that it felt like they were being violated, but I just didn't know when to say, I'm not comfortable with this, and being really firm in my decision when it came to medical, like even just saying something. And I think that's a huge thing nowadays, is really being firm with your beliefs. And what can we do with this information? What is next? Yeah, it's important in knowing our rights. Facilitating self-empowerment allows us to enjoin good and forbid evil on the collective level. That's great. With this information, I can remember it before going to the doctor to make sure I'm receiving the best care. That is great. I really appreciate you all for having this conversation. I think that's so important, to know your rights and really understanding that, like, you can apply these rights. If you feel like you're not getting treated correctly, you have every right to, say something about it. And having those boundaries, really expressing them. And how do we keep this conversation going? I think for me, keeping this conversation going was not only looking at my own experience, but understanding that this really impacts people, and that people's preconceived notions can really harm people. Keep advocating and spreading the word on social media with family and friends. This is a public health issue, definitely. Keep advocating for yourself. Keep advocating for others. Keep talking to different people, seeing all aspects of care. It may have just been one person that did something wrong to me, and that's just that one person. It's not all the healthcare providers in the world. It's just one person. But you have to take that with a grain of salt and say, like, definitely keep having those conversations on medical trauma. And I think a huge thing is keeping the conversation going by looking at not just the patient, but looking at the providers. How do they keep this conversation going? When it comes to compassionate care, holding people accountable, as well as, knowing your rights. Does anybody have anything else they want to say about that? Or if there's any other questions or anything. Sharing our own experiences encourages others to share their experiences too. So being willing to share our story when ready. Correct. And and sometimes that is, having that patient responsibility of not just letting someone continue to provide care that may be harming the community more than it's doing good. So then holding that person to a standard and going to that state agency office and really talking to them about it. Any questions or anything that you all would like to discuss? No problem, Grace. Thank you. Well, there's nothing else you all would like to discuss. I'll stay here till 3:30. If anybody else has any other questions or anything like that. Thank you. All right, I think that's good. Okay. I think a huge goal for me was really like talking about this. And I think letting people know that like, if you're going to be a care provider one day, or if that's a goal for you, you can provide trauma as much as you can provide care. And I think I didn't even know what medical trauma was. And I used to be a CNA, and I felt like I didn't know what it was. I knew what it was, but like no one really explained like the aftermath and how that can really impact somebody. And it made me realize that when it comes to providing care one day, I would like to be someone that is gentle and understanding and wants to actually help somebody and not abuse any power or anything like that that I may have. Any other questions or anything you all would like to talk about? All right. Well, if there's no other questions, I guess we might as well not drag it out. If anybody has any questions for me, I'll leave my email in the chat. And you all can email me there. And again, if you need any of those resources, again, you can go on the UM-Dearborn website and get the CAPS and counseling services information, and as well as you can email me for it and I'll be happy to send it out. No problem, Tia. Thank you for coming. Thanks. All right, you all, I guess we'll end it 10 minutes early. You all have a good rest of your day. Have a great weekend. And make sure you do good on your finals and stuff. And I appreciate you. Thank you. I really appreciate that. It's been a struggle. I mean, it's really been one of those like really looking at myself and saying like, of course this happened. I shouldn't overindulge in it. And I think the next step for me was really saying, I know that this provider provided a not good care to me, and I'm okay with going against this person. And that was my next step, was really saying like, okay, I'm going to report this provider. And, you know, it was hard because there's people that will say, this person is educated, they went to school for this. Who are you, you know? And I'm like, you know, just because someone goes to school for something doesn't mean they don't have the right to provide adequate care to somebody or treat somebody like a human. If you experience pain, you should be able to experience that pain. And you should be able to address that pain. It should not be something that people make you feel bad for experiencing. Because we're all human. We all have feelings, you know? And it took me a really long time after my experience, because I was really looking at it. I was like, okay, let me look at it from a provider standpoint. What I had, like, of course, like I was only a CNA, so I don't really know that much information, but I'm like, if I was providing care, what would I have done? And I looked at all of these aspects, and I was like, I wouldn't have done that. I would never tell someone not to feel pain. And when someone looks upset, never will I just omit that, you know, never will I say, oh, let's just continue. Let's not talk about it, you know? If you're upset, I want to hear what you have to say. If it's something I've done, I really want to hear what you have to say, you know? And I think that was a huge thing. Are there any more questions or anything? All right, you all. Well, I'll say this. You all have a good finals, good final week of school, as well as good finals. This presentation will be on one of the CAP's website, as well as, so if you want to come back to it and get some more information, or you have any more questions, you can all feel free to email me or anything like that. And I would love to collab with you all and really, like, you know, keep spreading awareness of this, as well as, you know, being patient advocates. We should all want to be that, you know. I think that's a huge thing. You all have a good rest of your day. And yeah.